Okay, so what is DR and why do we care and who gets it and all of that? So diastasis recti, DR, is not just a postpartum thing that we deal with. It is anybody with a core can get issues coming from their abdomen, can lead to DR, and can lead to issues down the line. And so that's why I'm talking about it, because I think it's really interesting and I see it all the time, and people don't really have a good understanding as to like why it's happening, or even what it is and what to do about it. And so let's talk about pregnancy first. 100% of pregnancies will have that abdominal separation because it makes sense. Like they're stretching, they're making room for babe, and everything has to stretch. And then in postpartum, typically we see around 8 weeks or so that tissue extensibility starts to come back and there's not as much of a separation anymore. And even if there is a separation, it doesn't really matter. It just matters how your core is functioning underneath that and can control your intra-abdominal pressure. And so that's what we work on with postpartum. That aside, now take an athlete, someone who has recurrent groin injury, a core injury, for example, which used to be called a sports hernia, but orthopedists want to change the name because that's confusing for people. It's not a hernia. It's essentially like a tear in the abdominal fascia, but there's no intestines, no abdominal contents are coming out. It's just a lot of pain and in the groin region. So that type of person, we're going to look at their core function because we know that anatomically the connection between the obliques, so say external obliques, which fibers run 45-degree angle this way, coming down, 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 fascia, pubic symphysis, adductor, opposite side. External oblique, opposite adductor. And then the internal obliques, which their fibers run the opposite way, coming down, 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 same side adductor. So it's relevant if you're ever trying to rehab anything in like the lumbopelvic region in the front to focus on core function too. Next type of person might have a hernia. So an inguinal hernia, an umbilical hernia, any hernia where we see that probably for years before, pressure leakage coming out the front and something's got to give eventually, and then we get a hernia. And so that type of person, same, we're going to teach them how to manage that pressure. So 1, they don't get another hernia. 2, they don't make their current hernia worse. And 3, it helps with their pain and their function. So athletes, groin strains, pubic symphysis dysfunction, any core injury, hernia. How many people do we see in our practice with has a history of hernias or have one? So many people. Postpartum is just so common. So my next video, I'm going to talk about how I assess what I'm looking for, and then what to do about it. This is sort of just the background on the why behind the what. Okay, so this is part 2 where we'll go over some just kind of basics, some breathing mechanics, and some core activation. Really simple phase 1 stuff, but in my mind, foundational. Get really good at the phase 1, and then phase 2 and phase 3, harder strength exercises, more dynamic things, are a lot easier to do. So the first thing we're going to start with is breathing, working on expanding outward with the rib cage, and not just here and not here. And this is really hard for a lot of people, especially with diastasis recti, because every time they're inhaling and all their pressure and all the extensibility is coming out the front, the front, the front, and we're not load sharing into the side, and that's what we want to be doing. So I'm gonna lie down. I like to put my legs on something, but you can also just have your legs bent. You just kind of want the hip flexors to be relaxed. So from here, neck and back and low back, everything's in neutral. I'm relaxed. I'm not too worried about what's happening. If you can breathe through your nose, your lips will be closed, your teeth apart, your tongue's resting on the roof of your mouth, chin slightly tucked, ribs down. So from here, we're just inhaling. Put your hands on your side rib cage. And then let it go. You can also just exhale through your nose, but I like to go audibly through my lips because it helps me sort of just really activate things. Inhale, expand. And exhale, just let that go. So you're going to do that a few times. You're going to just work on, can these ribs go outward? This is eccentrically kind of, stretching the obliques, everything that attaches down there, and just feels really good, and it is relaxing. So number one, work on extensibility of that rib cage going laterally outward. And number two, we're going to actually activate our deep core, so our obliques and our transverse abdominis. So inhale, expand. Exhale, pursed lips. And you're going to let all your air out. There's no more air left to be had. And you should feel at the end of your exhale, your ribs coming down and in together. So pay attention to that. So exhale, ribs coming down. Second part is your pubic bone is coming together. Not literally, not like our ribs are, our pubic bone's not literally, but you should kind of feel that like cinching down and in, as well as the side wall should be firm. Like it shouldn't be like squishy here. If it is, you're not doing it right. So inhale, expand. Exhale, ribs come together, pubic bones come together, and the side wall is firm. And you shouldn't see any doming or coning here. It should be nice and flat. You could have the biggest separation in the world, and if you're doing this properly, you won't see one. Okay? So from there, you can now add a block. So you can inhale, expand again, exhale. Squeezing the block at the end. Inhale, exhale. Squeeze the block. Remember, connecting groins to our obliques. Perfect. Do that for a while. Get good at that one. Next, we're going to be in this supine 90-90. If you lift and there's coning and doming right away, whoa, okay, we're not quite ready for that. Try to see if you can lock that up with the technique you just practiced on exhaling. And if you can't, then you might not be ready for this position. And that's totally fine. Many people aren't. And so feet come down again. And then on the exhale, expand laterally. Inhale, exhale. I'm just going to lift one heel. Inhale. Exhale. Good. Get really good at that one, and then all of a sudden you can add both, and then it's good. And then from there you can move on to different variations, but that's kind of the basics. So work on just lateral expansion, outward expansion on your inhales, getting good extensibility, not extending here and not extending or expanding here, going out. Then bracing, so with your exhale, everything's coming to midline. We're load sharing. All of our load isn't coming out the front, it's coming out 360 degrees. Then add in the groin squeeze. Exhale, things coming in, and then knees squeeze. Then try the supine 90-90 with the legs up in the air, and if that's too hard, then put one heel down and just lift on the exhale. That would be part one, pretty much. I would do mostly that, and just get good at that for a few days, and then start doing a few more dynamic things. If in that session that's super easy and no issues whatsoever, everything's perfect, then I would progress on. But I'm going to do a different video on that because this is getting long. But let me know if you have any questions, if that makes sense, how it feels, and yeah, just we'll keep going with the progressions next video.